Hey, Sibylla. Hey, I'm going to attempt to do this on a video. Something for you to do with your roller, and you can take bits and pieces of it um, and do it on your own, or you can do the whole sequence, and it's just going to be for the upper body. I hopefully did a video for your sister, and we'll see how she likes it, and you can use that too. So let's try this. And I'm going to start by laying on the roller. So I'm going to pause the video, get set up, and then start it up again. So we're going to lay on the roller first. And anytime under 10 minutes in one spot, never over 10 minutes in one spot. And we're going to run through it kind of quick. So you decide what you want to spend more time on. Okay. See how this goes. Slow and easy. You put the roller behind the sacrum, behind the lower back, and you roll on up. And then you make sure too your head is on top of the roller. Your feet about hip width apart on the ground and bent. And it's not a perfect setup with the camera, but you know what I mean. Yeah. All right. It's not professional. It's just something for you, okay? So when you're here, pretend you're a big boat on the water, and you just let both hands guide you when you go to one side. This is really meditative. This is wonderful for the nervous system. Um, as Sue Hitzman says with her melt method, it's very rare that we have something on the spine, and we have little, I call them proploda. It's like fuse boxes along the spine, and they're full of nerves that are receiving sensory information from our skin and from our body, and they're attached to the spine. They have a fancy name called sympathetic ganglia, and it's just a matter of, let's just give it more information. If we give our body more information, it can make a better decision for us. And we don't have to think about it. It just happens. So just be a big boat on the water and let the waves kind of move you. Boats have stabilizers in them, and we do too. And it's just nice and easy. This is how I want you to start. If you get a little bit dizzy, come off. But if you can, let's bring both arms up. Now you can see my arms are straight. And then I want you to bring your shoulder blades down and then up. Shoulder blade goes down and then up. Try this with your breath. So come up, shoulder blades down. It's not a big movement, is it? No. Inhale, shoulder blades up to the ceiling. It's not a big movement. Exhale, slow. The shoulder blades hug the roller. They're coming down, and then up, and then down. Okay. So one hand on the floor, and then the other hand. So this hand is on the floor. This hand with the elbow, not looking at me or the camera. This is that small motion. So you're looking directly up to the ceiling, your head straight ahead, up at the ceiling. And look at this elbow movement. This is very slow. There's a reason. Every time I'm doing this, all of the muscles that are on the inside of the shoulder blade are touching the roller. And this is a massage. And we can do it ourselves, giving the body more information because of the pressure that we're using with our movement. Fantastic. And go slow. So hold that here. Take a breath in. As you exhale, pull the elbow away from you diagonally. Now let it relax. When you're ready, breathe in again. Exhale, pull that elbow diagonally away from you. Yeah. So ideally here, go back to your big boat. And it's just simple and easy. And when you're on your big boat, your nose, your breastbone, and your belly button are all in the same line. And they travel in the same line from one side to the other. So you can't see it, but we're going to do the same thing on this arm. And I'm going to turn around so you can see it. So you can stay exactly where you have yourself. No worries. I'm just going to move myself so you can see what's going on. So the elbow is, the hand is resting on the breastbone, the breast, or the shoulder, whatever you like. And this elbow is a little bit towards the video camera and up and away. We've opened up this spot, and it's the shoulder blade underneath in the inside shoulder blade that gets that massage, but also this muscle right here, it's getting a little bit of a, how do I say? It's also having a little bit of love. It's really nice because it's not very often that this one is stretched. Yep. Okay. So now that we've rolled this around a little bit here, take a breath in through your nose. Draw your elbow up and away from you. Exhale. Let it go. Inhale. On the exhale, drag it away. Yep, get that stretch. Good. And then you go back to your big boat. Nice. Sorry for the little bleep bleep with my phone. Totally forgot to turn that thing off. So what now? You have to get off. Let one leg go long. Roll over to the side. And I want you to bring this roller right underneath the arm. So here is the armhola. Here's the armpit. Can you be a little bit lower than that? If this is too painful, then be in the armhole. If you can, be right there. Now this is actually pretty sensitive and it's pretty hard. So do what you can. Ideally, you have your hand behind your ear. This is the vagus nerve, very to the surface level of the ear. So just let your hand rest there. Slow and easy. Move forward and roll back. And put your hand here and your elbow up. As you can see, I come back and I just relax with it and I come forward. This is not fast. No, not fast at all. You can bring your arm up, stretch it up to the ceiling, up, 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 up. And I have one that I didn't show you. You're going to get in the fetal position. You're almost in the fetal position, but let this arm be long and just try to curl in and then relax and curl in. Just and slowly relax. Okay, now your head's had a little bit of work. So you find the roller, and I'm going to get a little bit closer so you can see what's going on. And look, the ear is on the roller. Now we're just going to turn up and down, up and down, up and down. It's simple and it's easy. And this roller is on the hairline behind our head, and it's on the skull. It's not on the neck, it's on the skull. Really important, because that's the attachment for a lot of fascia. That's the attachment for a lot of muscles coming up, fitting into the scalp and the head. And just turn your nose up a little bit so you find that point on your scalp, the skull, that maybe it's a little sensitive. Just take a little time and go in circles. All right, now we're going to roll onto your back. And again, when you're in this position, you can see my neck. The roller is not on my neck. There's a little bit of traction, and I can stay here and just relax. But nice and slow, I'm just going to tip and then tip up. And tip and then tip up. This is where you're kissing somebody that's a little bit taller than you. Right about there. And back down. And you see how small this is? Oh, keep it small. These stabilizers that we have inside our body, just like a large ship has, a large boat, they're very sensitive to pressure changes. And if we can make our pressure changes slow, it's easier for the body to kind of, in a way, get it or understand. It's almost like the body says, oh, no problem. We just made a course correction and we're okay. So that's what we want to do, because all of these pressure receptors live right beside pain receptors. And for anybody having pain, we want to calm down that part, especially if the pain is from a past trauma. So now we've done this, and I want you to roll over onto the other side and finish the other ear, and then finish the underside of the other arm. So you'll be here. And you'll be there. Well, I think you can see this picture a little bit better. As you can see, the roller is nice and parallel. And I'm looking up. And the roller is behind the ear on the skull, and I'm looking down. Yeah. I realize that the coloring and the light is not the best. But if Sibylla, if you can't understand what we're doing, then you have to reach out and text me and let me know, okay? So now turn it up a little bit, and then with your nose, just find small circles. So as I said again in the beginning, you can take any of these parts and you can do up to 10 minutes. Anytime that you're doing this, just try to go as slow as you can. Sen gångare, which is a sloth in Swedish. It's really about that. Now, let's bring this underneath. Remember, we did a couple things. Here is underneath the armpit, and there it's just a little bit under that. Now, be careful with this. You have some scar tissue here. The hand is underneath the ear, supporting the head and the neck. And what we've done is we're going to set ourselves up, and we're just going to go forward and back. If you want to, you can leave your hand here. We can also bring the arm up, which changes the movement a little bit. When you're coming back, try to exhale. Take your time, inhale. It might be kind of sensitive right there. It's okay. Imagine what it would be like if the pressure sensors never got information. Let's do one more. It feels really good. Okay. If you want to, bring the arm up. Just stretch it up, up, up. Oh, yeah. And now we're going to do that little bug thingy. I don't know a name for this, but you're in the fetal position, and now you're just going to come forward. It's like you're getting more fetal, more of a baby. Come forward. Bring the hand down. It's a little bit easier. Whoa. See how slow that is? And then you bring the chest up, and you curl in, and bring the chest up, and curl in. Well, the evening sun is setting, and that means that I'm almost out of light. So I have to say this is the end of this session. So now that you have some information, and if you want to, you can lay on your back and you can just find out how this feels. What's your head feel like? What's your body feel like? Is it so much easier to be on the ground? Oh, who knew the ground was that comfortable, right? It's amazing. Okay, well, Sibylla, have a very good night or day. So whenever you decide to do this, good for you. Enjoy. And I hope you actually have a little bit of laughs from me trying to do this, but have fun.